and welcome to Creative Chiropractic. I'm Dr. Mike, and you are part of our first ever video Facebook that we've ever done. We're going to be doing these once a week, every week, to try to help you and educate you in what we do here and why we do it. Some of you have seen chiropractic before and have ideas what you think it's about. Some of you have never been to one. The purpose of these is to educate you on everything that we possibly do and give you advice on your health care and how you can pursue it. Why don't you come on in with me right now, and I'll show you the staff and what we do in here. So here we are inside. So when you come to Creative Chiropractic, the first thing you do is come up to the front office here and you'll meet Karen. She'll be doing all of our scheduling. She'll be doing any of your insurance verifications or authorizations if need be, and helping with any of your payments and reschedules. Karen?
Hi, looking forward to meeting you.
This here is Alyssa. She's our office manager. She basically runs the day-to-day operations of the office, as well as the expansion that we're going to be doing soon, which is kind of a teaser for what's to come. She also does a lot of our laser therapies back in the back office, and she will be doing our Motivational Mondays, which are something to come in the future as well. Alyssa?
Can't wait. I'm looking forward to meeting everybody.
So now that you've kind of seen some of the staff, our CA is not here, unfortunately. Bree, you'll be meeting her as we go. We also have 3 different massage therapists, soon to be 4. So we can pretty much take care of a lot of your needs you have. So now, right now, let's walk back in one of the rooms. You can see a typical visit and what we may do, okay? Follow me. So here we are in the typical treatment room. Some of you may be patients here. Some of you may have been here before. Some of you may have never seen a chiropractor before in your life. The purpose of these weekly videos is to teach you what we do here and about the power of chiropractic. What we do may be different than other chiropractors do, and this is not meant to say one is different or better than the other. The power of the adjustment is amazing. So what you've got to understand is that we may all do it a little bit differently, but the magic is in the adjustment. This is some of the things we do to add to that to help your overall health ability. What you'll notice, in my belief, is that the muscles, the joints, and the nervous system all come together as one. You cannot affect one without the other. So if I'm going to adjust you, the purpose of chiropractic is to free up the nervous system, allow the brain, which runs everything, through the power of the spinal cord, to get to the cells to allow them to heal and regenerate the way they're supposed to. When you have interference of the nervous system through subluxations or injuries to your body, this affects the brain's ability to control what it needs to do. By adjusting the spine, we eliminate that restriction and we allow the body to help itself. Now, through the course of this, sometimes maybe you tore a muscle, maybe you damaged a joint, maybe you have all kinds of chronic issues that have affected you for years, then we will bring in physiotherapy techniques to augment to this. We use a lot of electric stim to try to loosen up the muscles before. If I'm going to adjust you, I have to get through that tight muscle to the joint, then we drive the joint. If the muscle's in a guard, it becomes uncomfortable or difficult to move. So the goal is to get the muscles relaxed first. We may use ultrasound to remove inflammation. We use a lot of lasers here. Technology has given us the ability to heal things so much faster than we used to be able to do. Once we get the muscles to this point that we can go into the adjustment, then we will apply the adjustment wherever it's needed. At that point in time, what we have learned through technology is that at that point in time, we just freed up that joint. We've eliminated the restriction, we've allowed the nervous system to function, but we still, at that point in time, have an unstable joint unless the muscles are turned on to work. This is where we will come in with, in our practice, use a lot of lasers to activate the muscles, to allow them to stabilize around that joint. How many of you went to a chiropractor before and said, God, it felt great for a day or 2 or 3, doc, and then it tightened back up again? Well, this is what we have found with technology. We can now turn the muscles back on so the brain doesn't lock things back down for stability purposes. One of the ways that I adjust primarily is diversified, which is with hands. We have drop tables, we have flexion distraction tables. In some cases, I'll use what's called an adjuster, which is a powered activator. We use a lot of percussive work to break up the muscles and the tissues. We also will use Graston, which is a deep tissue technique to break up scar tissue. This allows the fact that the healthy muscle is filled with scar tissue. There's not much you can do until you eliminate that. These are more for chronic cases, but what you'll find is that through different techniques, we can deal with a lot of issues that you probably didn't even know were part of chiropractic. Let's walk back down to the office and we'll look at some other things we've got in here, okay? So those are the 3 main treatment suites that we use. Now we're going down to the laser suite, show you some things we do in here. This is where we will do our functional movement exams, which is where we put your body through tests to challenge the core to find out where you may or may not have weaknesses. If we can strengthen the core, we can deal with a lot of long-term issues that maybe you've had that you never even knew you had before. This is also where we do a lot of our laser therapies. We have 2 different types right now. The first one is the EVRL laser, which I will use on almost everybody on a daily basis. We use these to activate the muscles, to turn them on, to reduce swelling, to help basically take a lot of tissues at the cellular level and promote their healing at a faster rate that we could never do before. This is the FX635 laser. This has a lot of power and can do a lot of things that, once again, I never did before. This is going to be a topic of a Facebook Live post all on its own here very soon. In fact, we're going to be doing that next week. So if you have a question about the laser and what it can do, concussion protocols, ADHD, dementia. We're dealing with post-op issues, we're dealing with frozen shoulders, disc herniations, things that we could never deal with before, and some things that we did, but we couldn't have this kind of ability to do it at this rate, okay? Now, let's head over here to the x-ray. You can see what we got here. All right, here we are in the x-ray suite. X-rays are not needed for every visit, but sometimes red flags come up, and for your benefit and mine, I think it's best if we don't guess about your health, we know for sure, and we have the capability here to take the x-rays. We'll have them taken and read within 5 minutes, and we can move on with our treatment protocol based on what we've seen if needed, okay? Come with me, let's go look down here. All right, so here, what you'll find, this is Yuri. He's our insurance biller. He's the person who will take care of all of your billing needs. Any questions, you call and he'll be happy to answer them. One other thing too we offer here at Creative Chiropractic is we are members of ChiroHealth USA. Many patients come to us say, oh, I have chiropractic insurance, which you may have, but you may have a $5,000 deductible. You may have benefits that are less than what you thought. We offer a program here that allows you to legally change the way that we bill things that we couldn't do before, which takes a huge financial pressure off of you. But once again, any questions, he'll be happy to take care of you. Thank you, Yuri. Now,
Nice to meet you.
come on over here and let's look at some massage rooms. We have 2 different massage therapy rooms, and this is one of them here. This is where you will get not only full body therapeutic massages, sometimes dealing more sports massage. There's an array of treatment techniques that our massage therapists use. This will also be a whole nother focus of a Facebook video post that we'll do probably in 3 weeks, where the massage therapist will tell you exactly all the different techniques they do and what the purpose of them is, okay? We all know about the nice foo-foo relaxing ones. Sometimes there's other needs, all right? So now, let's head up here and let's talk a little bit of philosophy. All right, so this is kind of a brief view of our office and some of our staff. There'll be more that we'll be meeting later. The goal of all of these is to every week give you new information to utilize in your healthcare pursuit. Our society is demanding more control over their healthcare. We live in what I would not call healthcare. We treat sick care. We don't treat the symptoms, we don't treat the problem, we treat the symptoms. We also in the last 20 years have developed an opioid epidemic in this country by trying to stop the pain instead of actually dealing with the pain. Now we have a backlash from that. We don't treat pain here, we treat the problem. If I took the pain and took it away, that means we've taken the problem away. Listen to your pain, it's valuable. Your brain is telling you don't do something. If you keep ignoring it, put it in the closet, pretty soon it's going to cause you to have a major problem that could have been dealt with a long time ago. Our goal here is education. Our goal here is to do everything we can to get you into a healthy state of life and get you pursuing the goals you have in life, whether it be playing with your grandkids, your children, playing sports, doing things that you've always wanted to do, and because you have neglected your health, can no longer do. That's our goal here. So I'm telling you, put down the Advil, pick up the phone, give us a call, and we'll make sure we can take care of your health care in many ways. Next week, look forward for laser protocols and how they work and why they work. We'll see you next week. Thanks for coming. Bye.